The ICU doors blew open at 2:14 a.m., and the man they wheeled in had no business still breathing. Commander Tate Harlow, Navy SEAL, decorated sniper, classified overseas operative, flatlined twice in the medevac, flatlined a third time on the elevator ride up. The trauma team at Harwick Military Medical Center in Caldwell Bay, Virginia had seen bad. This was different. This was a man whose body had been torn apart by an ambush that wasn't supposed to exist. Every surgeon in that room was already writing the eulogy in their heads. Then the night shift ICU nurse pushed through, leaned close to his ear, and whispered 4 words that made the entire trauma room go absolutely still. If this story already has you hooked, follow along until the very end. Hit like, and drop a comment telling me what city you're watching from. I want to see how far this story travels. The night had started the way most nights started for Dara Voss. Badly, and getting worse by the hour. She had clocked in at 11, inherited a unit running on fumes, and spent the first 90 minutes chasing a potassium drip that someone had charted wrong on a post-op patient in Bay 4. By midnight, she had 3 critical patients, 1 malfunctioning ventilator, and a charge nurse named Belinda Marsh, who had already made 2 comments about Dara's documentation speed and 1 about her hair being improperly secured. Belinda had a gift for finding the exact thing a person didn't need to hear at the exact moment they least needed to hear it. Voss? Belinda appeared at the nursing station with a clipboard pressed to her chest like a shield. Your notes from Tuesday's overnight still haven't been countersigned. I'll get to it. You said that yesterday. Then I'll get to it today. Dara didn't look up from the monitor she was recalibrating. Unless you'd like to take Bay 4's potassium situation off my hands, so I have time to do paperwork. Belinda made a sound that wasn't quite a word and moved on. She always moved on. That was the thing about Belinda Marsh. She'd been the charge nurse at Harwick's ICU for 11 years. And in 11 years, she had developed an unshakable belief that the unit ran on her authority and her documentation standards and her approval of whoever occupied the nursing staff beneath her. She was not cruel exactly. She was the kind of person who made everyone around her feel like they were slightly behind on something. Dara Voss was, by most accounts on paper, exactly the kind of nurse Belinda should have liked. 33 years old, certified critical care specialist, consistently high patient satisfaction scores. She had joined Harwick 14 months ago with a spotless reference from her previous employer, a regional hospital in Anniston, Kentucky, that no one at Harwick had bothered to call. Because her paperwork was clean and her clinical assessments were fast, and nobody in hospital administration had the bandwidth to go digging when everything looked fine on the surface. What the paperwork didn't say was that before Kentucky, before nursing school even, Dara Voss had spent 6 years working signals and behavioral analysis for a Joint Special Operations Support Unit, a position so thoroughly unacknowledged by the government that it didn't appear on any resume, any background check, or any of the 3 security clearance reviews she had passed during that time. She had trained with operators, worked inside classified interrogation frameworks, studied the neuroscience of stress-induced dissociation in captured soldiers, and spent 18 months embedded with a SEER program, survival, evasion, resistance, escape, analyzing how the human nervous system behaved when a person's mind decided that dying was preferable to talking. She had left all of that behind. Voluntarily, mostly. Some decisions are less voluntary than they feel at the time, but she had made peace with that. She had gone back to school, earned her RN, then her critical care certification, and she had found something in bedside nursing that the intelligence world had never quite given her, the uncomplicated satisfaction of a patient who was alive because of something she did with her hands. She was checking the vent settings in Bay 3 when the radio at the nursing station crackled with the advance call. Incoming trauma, military transfer from Langley Airfield. ETA, 4 minutes. Classified patient, 2 escort personnel, request ICU hold on Bay 1. Belinda picked up the phone immediately. Dara heard her paging the on-call trauma surgeon, Dr. Prescott Gale, and the night shift intensivist, Dr. Sandra Fitch. Within 90 seconds, the unit shifted into the particular controlled chaos mode that Dara had learned meant someone important was dying. She moved to Bay 1 without being asked, started pulling supplies, checked the crash cart, verified the defibrillator charge. Belinda came around the corner and stopped. Voss, I need you on Bay 3. Bay 3 is stable. I didn't ask for your assessment. Mrs. Alvarado in Bay 3 has been stable for 4 hours. Her vent pressures are in range, and her last gas was normal. Whoever's coming in is going to need hands. Bay 1 will be covered by Dr. Gale and the trauma team. Dara looked at her. Then I won't be in the way. She didn't move. Belinda held her gaze for 2 seconds, then turned and went to go stand somewhere she could look supervisory. That was another thing about Belinda Marsh. She never escalated anything she wasn't sure she could win. The doors came open, and the gurney hit the threshold at speed. The man on it was large, or had been once. Right now he looked like something that had been compressed by tremendous force. Not just the obvious wounds, the field dressings packed into his left shoulder and along his right side, the splinted forearm, the bruising across his face that had gone dark and architectural. But something deeper, like the structure that held a person together, had been under impossible strain for longer than a body was meant to endure. 2 men in civilian clothes jogged alongside the gurney. One of them was on a phone. The other had his eyes fixed on the patient with an expression that went past professional concern into something personal. 3-time flatline in transport, the medevac medic said, handing off the chart. Resuscitated twice with epi, once with compressions. Vitals are hanging. BP 64 over 40, SATs at 88 on high flow, heart rate 41 and irregular. GCS 3. GCS 3. The bottom of the scale. Eyes closed, no verbal response, no purposeful movement. Medically, that number meant the brain was barely there. Dr. Gale came through from the other side with Sandra Fitch half a step behind him. Gale was good. Dara had worked with him enough to know that, and he went straight to assessment without ceremony. He checked pupils, pressed on the abdomen, ran his hands along the rib cage while the medic kept talking. Blast injury, secondary fragmentation to the thorax. We've got a pneumo that was decompressed in the field, probably reaccumulating. GSW left shoulder through and through. Possible internal bleed. Fast was inconclusive on the bird. OR. Trauma bay first. He might not make the OR. One of the civilian escorts stepped forward. He was maybe 45, gray at the temples, the kind of composed that looked like it cost something. He needs to stay on this floor. Those are the instructions we've been given. Gale looked at him. And you are? I'm the person telling you he stays here. I don't take medical direction from, then take it from the orders in that chart. Page 2. Gale flipped to page 2. Whatever was there made him stop talking about the OR. Dara was already at the patient's right side, attaching leads, pulling the oxygen mask to check his airway while the respiratory therapist adjusted the flow. She was moving on training, on the muscle memory of 1,100 overnight shifts, and the particular calm that came from genuinely not being afraid of how bad things looked, because she had seen bad, and she had learned that bad was not the same as over. She put her fingers on his wrist because she liked to feel a pulse rather than just see it on a monitor. 40 beats. Weak. But there. She looked at his face. He was maybe 38. Dark stubble growing in over jaw and neck. A scar along the left temple that was old, years old, nothing to do with whatever had happened to him recently. And something else. Something in the arrangement of the muscles around his eyes and mouth that she recognized not as pain exactly, but as control. The rigid, effortful stillness of a person actively managing what their face was doing. GCS 3. Eyes closed, no verbal response, no purposeful movement. She watched his right hand where it rested against the bed rail. 3 seconds. 4. There. The index and middle finger moved. Not a tremor. Tremors were uneven, arrhythmic, and they stopped. This was deliberate. Index, middle, index. Pause. Middle, index, index, middle. Pause. She had not thought about that pattern in 8 years. It was a modified iteration of a signals protocol used by SERE-trained operators under capture conditions, a way of communicating without moving anything a captor would watch. Most military personnel didn't know it existed. The people who did know it existed had gone through a very specific program that was not on any public record. Dara kept her face completely neutral. She checked the lead placement. She adjusted the O2 sat probe on his finger. She did everything that looked like nursing, and nothing that looked like recognition, because if this man's nervous system was running a capture protocol, the wrong response from her would trigger a cascade, increased cortisol, vasoconstriction, cardiac stress that his heart could not currently afford. She leaned over him, close, as if checking the oxygen mask. She brought her mouth near his ear. "Dagger hold," she said. Very quiet. Just air and shape, barely even sound. The fingers stopped moving. The room did not stop moving. Dr. Gale was calling for a chest ultrasound. Sandra Fitch was adjusting the vasopressor drip. The respiratory therapist was rechecking the vent settings that didn't exist yet because they hadn't intubated him, and Gale was debating whether to. The two civilian escorts stood at the foot of the bed watching everything with the professional stillness of people who had learned that watching was sometimes all you could do. But the patient's fingers had stopped, and his heart rate, which Dara could see on the monitor above his head, climbed from 41 to 48. She straightened up, turned back to the med cart, kept her breathing even. Sandra Fitch came around beside her. "What was that?" "Checking his airway. You said something to him." "I told him he was safe." Dara pulled a syringe from the drawer. "Sometimes it helps." Fitch looked at her with the expression physicians sometimes used on nurses who did things without explaining themselves first. Not quite condescending, not quite respectful, somewhere in the territory between the two that medical hierarchy had occupied for decades. "He has a GCS of 3 Vos. Womasha as of 3 Vos. I know what his GCS is. He can't hear you." Dara didn't answer that. The next 2 hours were a storm. A controlled storm, the kind that hospitals ran on, full of organized urgency and overlapping decisions, and the particular teamwork that looked like chaos from the outside but had a structure when you were inside it. The reaccumulating pneumothorax got addressed with a chest tube. Messy, necessary. Gale put it in faster than most could have. The vasopressor drip got titrated. They got him intubated, finally, after Fitch decided the risk of not protecting his airway outweighed the risk of the procedure, and the respiratory therapist took over ventilation, and the numbers started, slowly, to move in the right direction. His blood pressure came up. 80/50. Then 86/54. Still wrong, but wrong in a direction that was trending toward less wrong. Gale stood at the foot of the bed at 4 a.m. and looked at the monitors with the expression of a man who had expected to call a time of death and hadn't needed to. "He should be dead," he said, not dramatically, just as a fact. "He's not," Dara said. "I know he's not." He looked at her. "What is he?" She understood he was asking about the classification, the escorts, the redacted chart. "I don't know," she said, which was technically accurate. She knew what he was, in general terms. She didn't know the specific mission. Gale nodded slowly. "Keep me updated." He left to go write notes. The escorts settled into chairs at the edge of the unit. They had IDs. She had glimpsed them when Belinda demanded the information for the patient registration. But the IDs told her approximately nothing useful. Civilian contractors, some flavor of federal. The composed one was named R. Halkett. The other one, younger, more visibly tired, had barely spoken since they arrived. Belinda Marsh materialized at the nursing station around 4:30 with a printout in her hand. "Voss, your assignment for the rest of the shift is Bay 3 and Bay 5. I'm pulling you off Bay 1. Dara was sitting at the station charting. She didn't look up. "Why?" "Because Bay 1 is a classified military patient with 2 federal escorts, and the administration has requested that primary nursing be handled by senior staff. I'm certified critical care. Nurse Kowalski has 8 years on this unit. Nurse Kowalski called out sick tonight." A pause. Belinda recalibrated. "I'm bringing in Hennings from the float pool." Dara put down her pen. "Belinda." She kept her voice level. "He just survived 3 flatlines. His pressure is marginal. His chest tube needs monitoring every 20 minutes. Whoever you bring in is going to need 2 hours minimum to familiarize themselves with where he is. That's 2 hours where something could change, and the person at his bedside doesn't know what normal looks like for him. You've had him for less than 2 hours yourself. I know, that's why I'm telling you not to hand him off." Belinda looked at her for a long moment. The printout crinkled slightly in her grip. "You're not the charge nurse, Voss." "No, I'm not." The silence extended. Then Belinda turned and walked back toward her office without finalizing the decision in either direction, which meant, for now, nothing changed. Dara had learned that particular move from her. When Belinda Marsh didn't want to be recorded as having made a call, she simply didn't make it. Dara went back to Bay 1. The patient was as stable as he was going to be for the moment, vitals unchanged, chest tube draining, ventilator doing what it was supposed to do. She checked the positioning of his arms, adjusted the angle of the bed, verified that the restraints, standard protocol for intubated patients, were not creating pressure injuries. His right hand was near the bed rail again. She watched it. Nothing for almost a minute. Then, 2 taps, index finger, fast, then a pause, then 3 taps, deliberate spacing. She recognized the second sequence too. It wasn't part of the standard escape code. It was a confirmation request, a way of saying, "Are you receiving?" She looked around the unit. The younger escort had his eyes closed in the chair. Not sleeping, probably, but resting. Halkett was at the far end of the unit talking quietly on a phone with his back turned. Dara reached out and placed 2 fingers lightly on the patient's wrist, the way you'd take a pulse, and she tapped once. The hand went still, and then the heart rate monitor above his bed spiked. Not dangerously, not in any way that would read as crisis to anyone watching the numbers, from 52 to 69 in about 4 seconds, and then settled back to 58, which was still low but was measurably, meaningfully better than 41. She stood there for a moment with her fingers on his wrist, feeling the pulse that had been close to nothing 4 hours ago now pushing back against her fingertips with something that felt almost like intention. She pulled up his transfer documentation on the tablet at the bedside, reading the parts that weren't redacted. Mission injury, field extrication, transported under classified transfer protocol, patient identity, restricted. Next of kin. Notification, restricted. Medical proxy, restricted. Commanding officer notification, restricted. The name at the top of the chart was listed as Harlow, T. And below that, in a field that was usually used for religious preference or dietary restrictions, someone had typed a single notation: SEER protocol initiated in field. SEER protocol initiated in the field, which meant that at some point between wherever he had been and the medevac that brought him here, someone had made a decision, either him or someone supporting him, to engage the training that was supposed to prevent captured operators from breaking under interrogation pressure. The training that rewired the threat response system to treat all external stimuli as potentially hostile. The training that would make every needle, every ventilator, every hospital bed feel exactly like captivity. He wasn't dying from his injuries. He was dying from his own mind's refusal to stop fighting. Dara looked at his face. The muscle control was still there, still that rigid management of everything the face might give away. But she could see now that she was looking for it, the specific quality of the effort, the way his jaw was slightly tight, the way the skin around his eyes was not slack the way unconscious people's skin went slack, but held, contained. She had seen it before. Once, years ago, in a facility she was not allowed to name, on a man she was not allowed to describe, during a training simulation that was not supposed to go where it went. She had been 26 years old, and she had watched a SEER-trained operator spend 36 hours in a simulated capture environment and come out of it with a resting heart rate of 38, and eyes that had gone somewhere most eyes didn't go. She had been the one who brought him back that time too. "I know what you think this is," she said quietly, not loud enough for anyone across the unit to hear. She was adjusting his IV line, doing something with her hands while she talked. "I know what it feels like from inside when the training takes over. Everything looks like a threat. Everyone in here looks like someone who wants something from you." She paused. His heart rate was steady on the monitor. "But the mission is over. Whatever happened out there, it's over. You made it back." The index finger moved once. A question, not an affirmation. In the language she was reading, it meant, "Prove it." Her mind went cold and clear the way it used to in the operations center, when everything narrowed down to the signal in front of her and nothing else mattered except reading it correctly. She had one shot at this. She could not prove she was safe through medical intervention. Every medical intervention was going to read as assault to a nervous system running capture protocol. She could not prove it through authority or official channels, because official channels were exactly what a capture environment used to extract information. She could only prove it the way SERE protocol actually got broken, by using the authentication system built into the training itself, a system that required knowing something that only a genuine ally would know. She leaned close to his ear again. And this time, she didn't say just 4 words. She said 11, in the specific sequence that she had memorized in a basement facility in Bragg, Virginia, 9 years ago, as part of a briefing that had classified her to a level she had never used before or since. The patient's hand opened flat against the bed rail. The heart rate went to 71. 74. 78. His eyes, beneath their lids, moved. Not the random movement of REM or the neurological drift of brain damage, but a directed, purposeful motion, like someone turning their head to look at something. And then, slowly, with the mechanical difficulty of a man whose body had been through the kind of damage that should have put him in the ground, his hand closed around the bed rail and held. Dara straightened up. She reached for the nurse call tablet and paged Sandra Fitch. When Fitch arrived from her office 2 minutes later, rubbing her eyes and carrying a half-eaten protein bar, Dara pointed at the monitor without preamble. His heart rate's been climbing for 20 minutes. He's starting to fight the vent. Fitch looked at the numbers. GCS? Improving. Dara turned to face her. I think he's coming back. Fitch stared at the monitor for a long moment with the expression of someone doing math they weren't sure added up. The vent was cycling normally, the chest tube was draining appropriately, the blood pressure was holding, marginally, weakly, but holding. That's not possible, Fitch said. I know, Dara said, but look at the numbers. Fitch looked at the numbers. She set down the protein bar. She put on a glove and lifted his eyelid, checking the pupillary response. And she went very still, because what she found was not the fixed, blown pupils of severe brain injury. What she found was a pupil that contracted. Get me a GCS reassessment, Fitch said, and her voice had changed entirely. And Paige Gale, now. Dara was already moving, but before she reached the door, something made her look back at the bed. Some instinct, some pull at the edge of her peripheral vision. Commander Tate Harlow's eyes were open, not all the way, not with any clarity, but they were open, and they were oriented, and they were locked on Dara Voss with an expression that she recognized from the old world she had tried to leave behind, the particular expression of someone running a threat assessment on the person in front of them, trying to determine whether she was the reason they were still alive or the reason they were going to die. His lips moved around the ventilator tube. No sound came. Couldn't, with the tube in place. But she could read the shape of what he was trying to say. It was not thank you. It was 2 words she had not expected. 2 words that told her everything she needed to know about how thoroughly his mind was still caught in whatever had happened to him out there. 2 words that meant the crisis was not over, had not even really begun, because Tate Harlow had just woken up from the edge of death in a hospital he didn't recognize, and the first thing his brain had done was go looking for the enemy. And the second thing it had done was decide that enemy might be her. The 2 words his lips shaped around the ventilator tube were, identify yourself. Not the words of a man waking up confused, not the words of a patient disoriented by medication or pain. They were precise, deliberate, formed with the kind of muscular control that required conscious effort from a body that should not have had conscious effort to spare. And they told Dara, in the space of a single breath, that whatever she had done by speaking those 11 words into his ear had not simply calmed him down. It had activated him. She had reached into the locked room where Tate Harlow's mind was still running a mission, and she had knocked on the door using the right sequence, and now the door was open. But the man standing behind it was not relieved. He was armed. She did not step back. Stepping back was the wrong answer. She had enough of the old training still in her body to know that retreat read as deception in this particular framework, that the protocol required a response that was immediate, grounded, and specific. She moved closer to the bed. Sierra 7, she said, low and flat, the way she had been taught to say authentication codes, without inflection, without the kind of upward modulation that stress put on the voice. Operational support JSOC attached. I'm not in the chain, I'm outside it. His eyes tracked her. The threat assessment expression didn't leave his face, but something behind it shifted. Some interior calculation that she couldn't read clearly, but could feel the weight of. His lips moved again. One word this time. When? 9 years ago. I was never in the field. I worked signals and behavioral assessment. She kept her voice below the ambient noise of the unit. The ventilator cycling, the monitors, the distant sound of Belinda Marsh's heels on the hard floor somewhere. I left the program voluntarily. I'm a nurse now. You're at Harwick Military Medical Center in Caldwell Bay, Virginia. You've been here approximately 4 hours. She watched his face. The jaw was still tight. The pupils were oriented, tracking, doing what healthy pupils were supposed to do. You're intubated, she said, which means you can't talk, which means I'm going to ask you yes or no questions, and you're going to blink once for yes and twice for no. Can you do that? 1 blink. Do you know where you were before the medevac? 2 blinks. Do you know how long you were in the field? A pause. Then 2 blinks again, slower this time, like the question was reaching somewhere that hadn't come fully online yet. That's okay. Do you understand that you're safe right now? The longest pause yet. She watched his eyes move slightly, that interior processing running behind the surface, and she waited because she had learned long ago that this particular question was not the kind that could be answered fast by a nervous system that had decided safety didn't exist anymore. 1 blink. Then immediately, before she could move on, his hand came up from the bed rail, slowly, fighting the restraint strap, and his fingers formed the shape of a question mark against the sheet. Not a SERE signal this time. Something more basic. Something that said, "Why you?" I don't know, she said. I didn't expect to see that signal tonight. I don't know who you are beyond what's in your chart. I just knew what it meant. His hand lowered. His eyes stayed on her face, still running the assessment, and she let him run it because there was no shortcut through this part. He had to determine on his own terms whether she was what she said she was. The protocol had always recognized that the ally couldn't prove themselves through argument, only through behavior over time, through the absence of threat, through consistency. What she had not expected was that he would pass out again 12 seconds later. Not flatline, his vitals held, the monitor sustained, the ventilator kept cycling, but the effort of those minutes of consciousness had drawn from a reserve that was already desperately depleted. And his eyes closed and the jaw unclenched, and he was simply gone again, back into whatever depth his body needed to pull him into in order to repair itself. Sandra Fitch came through the door at a run 2 minutes after Dara had paged her, and she went straight to the monitor, then to the patient, then turned to look at Dara with an expression that was trying to be clinical and not quite getting there. His pupils were reactive, Dara said. Brief period of apparent consciousness, maybe 90 seconds. He's back under now. Did he respond to you? Yes. Fitch stared at her. Purposeful response? Very. Gale arrived 4 minutes later, still pulling his white coat on, and the next 20 minutes were all medicine. Reassessment, adjusted vent settings, a repeat ultrasound of the abdomen that showed the internal bleed they'd suspected had been slow enough to be managing on its own, which was either lucky or anatomically strange, and Gale used both words. They drew labs. They checked the chest tube. They did the things that needed doing, and Dara did them alongside the attending physicians without comment, efficiently, accurately, because that was what the situation required, and it was also, she had come to understand, the most effective version of herself she had ever found. Around 5:30, when Gale had gone back to write his reassessment notes, and Fitch was on the phone with the lab, Halkett appeared at Dara's elbow. He had a particular way of arriving in a space, she had noticed it earlier, would notice it many more times, that made it seem like he had simply materialized, like he had always been there, and she had only just registered his presence. He was not a large man. He was the kind of man whose size was irrelevant because he took up exactly as much space as he intended to at any given moment. You spoke to him, Halkett said. Not an accusation, just a fact he was presenting for discussion. I told him he was safe. You said more than that. She looked at him. He was running an escalating sympathetic response that was going to put him back into cardiac crisis. I de-escalated it. With what? With words. She turned back to the chart she was updating. Is there a problem? A pause. That depends on what words. Are you his handler? I'm someone who needs to understand what happened in that room. She stopped writing. She turned to face him fully, which was a decision. She had learned that full attention was a resource you didn't give away without thinking about it. He exhibited behavioral signals consistent with active SERE protocol. I recognized them. I used a response that was appropriate to the framework. He de-escalated. That's the whole story. Halkett looked at her for a long time. He had gray eyes, the kind that didn't shift much, that stayed still the way the surface of water could stay still while something moved underneath. Where did you learn a response appropriate to that framework? That's my business. In this situation, a man who is going to die is now alive and his heart rate is 58 instead of 41. That's my business. She held his gaze. If you have questions about my clearance history, make some calls. But don't make them here and don't make them now, because I have 3 other critical patients in this unit and a charge nurse who's already looking for a reason to reassign me. And if you pull me into a conversation that isn't about his medical status, you're going to be the reason his nursing care gets handed to someone who has no idea what they're dealing with. Something moved in Halkett's expression. It might have been reassessment. It might have been the beginning of respect, or at least the recognition that she was not going to be managed in the usual ways. He nodded once, stepped back, and returned to his chair at the edge of the unit without another word. The shift ended at 7, and Dara did not go home. She told herself she was staying to do the handoff notes. She was behind on documentation. Belinda had made sure she knew that. But she sat at the nursing station after the day shift nurses came on, and she watched the Bay 1 monitor from across the unit, and she stayed because she didn't know how to explain what was pulling her there. Some residue of the old work. Some recognition that the thing she had reached into last night wasn't finished yet, that she had touched something that had reached back, and walking away from it now felt wrong in a way that she couldn't entirely justify medically. The day shift charge nurse, a man named Gord Sevier, who Dara liked moderately, came over at 7:40 and looked at her with the specific expression people reserve for colleagues who were still at work after their shift. Voss, you okay? Documentation. You look like you haven't slept. I haven't. Bay 1 guy? She nodded. Gord looked across the unit at the bay. Hell of a night. Gail told me the story. The parts of the story he's allowed to tell. 3 flatlines, and he's still here. He shook his head. Military guys are built differently. He's not just built differently, Dara said, and then stopped, because she wasn't going to explain the rest of it to Gord, who was a competent nurse and a decent person and had no framework for what she was describing. She finished the documentation at 8:15, and she was packing up her bag when the monitor at the nursing station registered a change in Bay 1. Heart rate climbing again. Not dangerously. It wasn't an alarm. It was just a trend. The number ticking upward in a way that she recognized now as purposeful rather than physiological. She went back in. He was awake again. More awake this time. Both eyes open, oriented, tracking the room with the systematic efficiency of a man accounting for every person and every exit. The restraint straps were holding, but she could see from the tension in his forearms that he had tested them, and the testing had been controlled and deliberate rather than panicked, which meant his executive function was coming back online. Still here, she said. His eyes found her and stayed. You lost consciousness again. That was about 2.5 hours ago. Your vitals have been stable. She moved to the bedside, checked the chart on the tablet, gave him something real to track while she talked. Your pressure is better, 79/51. Chest tube looks good. You need to stay on the vent a little longer. Your respiratory mechanics aren't ready to hold on their own yet. He blinked once. She took that as acknowledgement rather than question. You're going to want to fight the tube, she said. Don't. It's helping you breathe. And if you pull at it, you'll set yourself back 2 days minimum, and Dr. Gale will have a very bad morning. Something moved in his face that she thought might have been, in another context, almost a fractional shift toward dry humor. It vanished quickly. He was still running the assessment. She could feel it, that constant processing that looked like stillness from outside but was anything but. His hand moved, 2 fingers tapping in sequence. Then a formation she hadn't seen him use before, but that she recognized from the broader framework. A request code. He was asking for something. She watched the pattern repeat and worked through the translation, and when she got to it, she went still for a moment. He was asking for the date, not just orienting, calculating, running a timeline against something. October 14th, she said. It's Thursday morning. His eyes closed briefly, opened again. And something in his face changed in a way she couldn't categorize neatly. Not relief, not distress, but a kind of grim arithmetic completion, the expression of someone who had just gotten a number they had been waiting for, and it confirmed something they had been hoping was wrong. His hand moved again. This time the pattern was more complex, and it took her longer to translate, and when she got there, her chest did something uncomfortable. He was not asking where he was, or how he had gotten there, or anything about his medical status. He had accepted all of that. What he was asking, in the clipped, efficient encoding of a man who had no other way to communicate, and apparently had priorities he was not going to abandon, even with a ventilator tube down his throat, was whether his team had been recovered. She didn't answer immediately. She didn't know the answer, and she also knew that knowing the answer was above her access level, and probably above Halkett's too, or at least above what Halkett was authorized to share with her. I don't know, she said. I don't have that information. The arithmetic expression deepened. His jaw tightened again. Halkett is outside, she said. He's the person with access to operational information. I can get him. One blink, then immediately 2 fingers raised in a subtle but clear negation. You don't want him? 2 blinks. No. She waited. His hand moved slowly, the fingers forming shapes with the careful deliberateness of a man spending energy he didn't have. This wasn't a code sequence. He was spelling, slow, letter by letter, the way someone might write in the dark. B-L-A-C-K. Pause. T-A-L-O-N. She read it again. Black Talon, she said quietly. 1 blink. Is that a name? 1 blink. Is that who compromised your mission? 1 blink, and then something she wasn't expecting. His hand moved urgently, fast, and the pattern was a warning code. Simple, basic, one of the first things SERE protocol encoded, the signal that meant hostile, close. She looked up from his hand, looked through the glass of Bay 1 at the unit outside. Halkett was on his phone. The younger escort was gone. She didn't see him anywhere at the nursing station or the unit entrance. 3-day shift nurses were charting. Gord Sevier was drawing a blood sample in Bay 3. Everything looked normal. Dara looked back at Tate. Here? Now? His hand steadied. Not an emergency signal, not immediate. A different gradation of the warning. Something more like watch than run. She thought about the phone call Halkett had been on when she'd clocked in this morning. She thought about the younger escort, whose name she hadn't caught, who was now not where she could see him. She thought about the notation in the chart, SERE protocol initiated in field, and the question of who had put it there, because that notation hadn't come from the medevac medic, she was nearly certain, and it hadn't been in Gail's admission notes either. She had assumed it was from an intelligence brief attached to the transfer. Standard. Now she was thinking about the possibility that it was placed there deliberately, that someone had documented the SERE activation not to help medical staff treat him, but to make sure medical staff treated him in a way that kept him unconscious, kept him under, kept him from talking. Sedation. Intubation. GCS of 3. A patient who couldn't communicate, surrounded by official-looking people, in a classified case with restricted access. It was an extraordinarily effective way to silence someone. She pressed the back of her hand briefly against the back of his, a contact that could read as pulse check to anyone watching through the glass. Under the contact, against her skin, his hand formed 1 letter. Go. She understood what he meant. Not leave, but move, do something, use whatever you know to move on this. He couldn't do it himself. He was in the bed with the tubes and the lines and the restraints and the body that had nearly died 3 times, and he was trusting her with something that she suspected he had not trusted anyone with in a very long time, possibly ever. She straightened up, checked his monitor values on the tablet, made a note in the chart that was pure clinical documentation, unremarkable. She walked out of Bay 1 at a pace that was brisk but not urgent. She went to the staff bathroom at the end of the corridor, the single stall one that locked from inside, the one she used when she needed 45 seconds of silence in the middle of a bad shift. She ran cold water over her wrists, looked at herself in the mirror. Her hands were steady. That was the thing that had always unnerved people in the old work, that her hands stayed steady when other things didn't. She had never decided that about herself. It was simply the way she was built, and she had learned to be pragmatic about it rather than examining it too closely. She thought through what she had: a classified military patient whose mission had been compromised from inside, a name, Black Talon, that he had chosen to communicate over operational status or medical information, which told her the leak was his highest priority above his own welfare. A warning signal suggesting he believed the threat wasn't just external. 2 escorts who had arrived with him, and one of whom was now unaccounted for in a secure unit. She did not have clearance anymore. She did not have a chain of command, a secure channel, or an access level that would let her make the calls that needed to be made. What she had was a locked bathroom, a cell phone, and the number of a man she had not spoken to in 7 years. A man who had been her supervisor in the JSOC support unit, who had left the program 3 years before she did to go work for an inspector general's office that she had never looked up the name of because looking it up would have meant thinking about a part of her life she had been trying to set aside. She took out her phone, stood there for a moment with her thumb over the screen. She thought about Belinda Marsh's printout and the way Belinda had tried to pull her off Bay 1 in the middle of the night. She thought about how easy it would have been for someone to request that reassignment. Not through Belinda, who didn't know anything, but through someone above Belinda, through some administrative channel that Belinda would have experienced simply as a directive from hospital leadership, the kind of directive that happened all the time with sensitive military cases. She thought about Tate Harlow's eyes on her face, running the threat assessment, spending the last reserves of his consciousness on a warning. She dialed. It rang 4 times. She expected voicemail and was already composing the message in her head, the careful non-specific language that would communicate enough without communicating too much over an unsecured line. The call connected. "Voss," said the voice on the other end. Flat, unhurried, like no time had passed at all. Like he had been waiting, which was impossible, except that nothing in her experience of this man had ever been outside the realm of capability. "I was wondering when you'd call." She opened her mouth to ask how he knew, and then didn't, because the answer was either that he'd been tracking the Harlow case through channels she didn't have visibility into, or that he had some kind of alert connected to her name, and either option told her the same thing: that the situation she was standing in the middle of was larger than she had understood when she first heard a dying man's fingers tapping on a bed rail. "I need 30 minutes, she said. "I need 5, he said. "What did he tell you?" And somewhere on the other side of the staff bathroom door, out in the unit where Tate Harlow was lying in a hospital bed with a ventilator breathing for him and a name encoded in his fingers and a warning on his face, a sound broke through the ambient noise of the ICU, a sharp, distinct, unmistakable sound. The sound of a crash cart alarm going off in Bay 1. She said, "Hold on," into the phone and was already moving before the words finished leaving her mouth. The bathroom door opened and she was in the corridor at a run. Not a sprint, not the kind of movement that cleared hallways and drew stairs, but the fast, purposeful stride that ICU nurses used when the situation required speed and visibility required calm. The crash cart alarm had a particular quality to it, a rhythm she had memorized without intending to, and she was reading it as she moved. Not the flat, continuous tone of a flat line, but the intermittent alert of a monitoring threshold breach. Arrhythmia. Significant, but not immediately terminal. Not yet. She came through the Bay 1 door and took in the room in the 2 seconds before anyone spoke to her. Tate Harlow's heart rate on the monitor read 147 and climbing. His blood pressure had dropped. 60/38, the cuff on his arm still cycling through the automated recheck. The ventilator was alarming separately, a different pitch, because his breathing was fighting the machine's cycle, the 2 rhythms working against each other in the way that happened when a patient's respiratory drive came back online before anyone was ready for it. He was awake. More awake than she had left him 8 minutes ago. and he was looking at the door of Bay 1 with an expression that she had enough old work context to read correctly. He was tracking someone who had just left. Gord Xavier was at the bedside, adjusting the vasopressor drip with the focused attention of a man trying to stabilize a number while other numbers fell. The day shift nurse assigned to Bay 1, a woman named Priya, was pulling the crash cart closer as a precaution. Neither of them had looked at where the patient's eyes were directed. Dara looked at the door, then back at Tate. "What happened?" she said to Gord. "Came out of nowhere. He was stable, then the rate spiked and the pressure dropped. I think he pulled his arterial line. Look at the waveform." She looked. The arterial line waveform was dampened, the trace going flat and irregular. She checked the insertion site on his right wrist. The line hadn't pulled out completely, but the transducer connection had worked loose, which meant the blood pressure readings were now unreliable. She secured it, flushed the line with the saline syringe from the cart, and the waveform corrected on the monitor to something she could actually trust. 61/42. Better than the reading, but still wrong. She looked at Tate's face. His eyes had moved from the door to her. One of his hands, the right, the one that had been doing the signaling, was no longer restrained. The strap was still attached to the bed rail, but the buckle was open. He had undone the restraint himself. While monitors were alarming and staff were responding, he had worked the buckle open with one hand and no one had noticed because they were all looking at the numbers. She put her hand over his without making it obvious that she was checking what he had done. Felt his fingers move deliberately under her palm. Not the signal code. Something more direct. He pressed twice against her hand. 2. She understood. 2 of something. The younger escort, she still didn't know his name. Plus one more. Or 2 people, unaccounted for, somewhere in or near the unit. The rate on the monitor came down slightly. 139. The vasopressor drip was working, just slowly, the pharmacology running behind the physiology the way it always did. Gord let out a breath. "Okay, he's trending back." "I want to reassess the restraints," Dara said. "He's been fighting them. It's increasing his agitation." Gord looked up. Protocol says for patient safety. If the restraints are causing a sympathetic response that's driving his hemodynamic instability, the calculus changes." She kept her voice clinical, factual, the tone of someone making a medical argument rather than a personal appeal. "I'll document the reassessment. You can countersign." Gord thought about it for half a second. He was a reasonable man. "Fine, but I want his rate under 120 first." "Agreed." Priya was still hovering near the crash cart. Dara looked at her. "Can you check the chest tube drainage? The output should be tracking from the last hour." Priya moved to the other side of the bed. Dara leaned close to Tate's ear under the guise of checking the ventilator tubing. "Who went out the door?" she said. Not a question. A confirmation request. His finger moved once against the sheet. Halkett. She thought about the call that had been going on when she went to the bathroom. She thought about the 5 seconds between the alarm sounding and her arriving at the bay. 5 seconds in which a man who had been sitting in a chair 12 feet from the door had apparently left the unit rather than responded to the emergency involving the patient he was supposedly escorting. People did that sometimes. People panicked and retreated rather than helped. It wasn't necessarily sinister. But she thought about Black Talon spelled out in careful letters by a man spending his last reserves of consciousness. And she thought about the word watch and not run. And she thought about how a SERE trained operator's threat assessment, even impaired, was not a thing she was willing to discount. She straightened up. She took out her phone under the cart and sent a text to the number she had just called. 4 words, no punctuation, second escort location, unknown. The reply came back in 11 seconds. "Do not let anyone sedate him." She read it twice, put the phone away. The monitor showed 126, trending down. Gord was making notes, recalibrating the vasopressor dose, doing medicine. Priya was documenting chest tube output. The unit outside Bay 1 was running its morning routine. Shift change handoffs, breakfast trays on the general ward 1 floor down, the sound of an elevator opening and closing. Normal. Routine. Unremarkable. She had worked enough hours in enough high-stakes environments to know that the unremarkable was sometimes the most dangerous texture a situation could have. Dr. Fitch arrived at 8:53, which meant someone had paged her, and she came through the bay door with her hair still not quite settled and her coat half on in the specific expression of an intensivist who has had approximately 90 minutes of sleep and is being asked to process a deteriorating situation. She looked at the monitor, looked at the drip, looked at the arterial line, and then looked at Gord. "Talk to me." Gord talked. He was thorough and accurate and gave her the sequence of events in the order they had happened, which Dara appreciated because the order mattered here. Fitch listened without interrupting, which was one of the things Dara had come to respect about her. "Okay," Fitch said when he finished. "I want to repeat echo. I want to know if the internal bleed situation has changed. And I want to talk about extubation readiness, because if he's fighting the vent enough to drive a rate of 147, his respiratory drive is back, and we need to reassess." "He's only been on the vent 6 hours, Gord said. "I know, but look at the waveform. He's breathing above the set rate. His drive is there." She pulled on a glove and did a quick neurocheck. Pupillary response, sternal rub, hand squeeze command. Tate's hand squeezed on command. His pupils were equal and reactive. His GCS is better than 3. Significantly. He was a 3 on admission. He's not a 3 now. Fitch stepped back. "Get me the echo." "And Paige Gale, I'm not making the extubation call without him." She left to make calls. Gord followed to arrange the echo. Priya was documenting at the bedside computer, her back partly turned. Dara moved to Tate's side. "They're going to assess you for extubation," she said quietly. "That means if your breathing holds, they take the tube out. That means you can talk." His hand moved, urgent, the signal for timing. 30 minutes, maybe less. Another movement, a question shape. The call. "I made contact. He knows you're here. He knows about the name." The hand stilled, then one tap. Processing. "Is there anything else I need to know before Gale gets here?" she said. "Anything that changes what happens in the next 30 minutes. A long pause. He was doing the calculation she could feel him running. The calculation of what to share with someone who was vouched for by a framework rather than a chain of command, someone who had done the right things but was not inside the official structure. The calculation of how much to trust and how much to hold back, and whether the holding back was protection or liability at this particular juncture. His hand formed letters again, slower than before. HALKETTIS. She waited. BLACKTALON. The word landed in her chest like something physical. She kept her face completely still. She did not look at the door, did not look out into the unit, did not do any of the things that a body wanted to do when the ground shifted under it. Halkett was Black Talon, the man who had been sitting 12 feet from this bed for 6 hours. The man who had arrived with this patient and presented credentials and stood in this unit speaking in measured tones about medical directives and access restrictions. The man who had asked her what word she had used specifically to reach a SERE-activated operator. Not out of concern for the patient, she understood now, but because he needed to know whether Tate had communicated anything to her and what form that communication had taken. The man who had disappeared from the unit 8 minutes ago and had not come back. She looked at the monitor. Heart rate 118. Pressure coming up. He was stable enough. Stable enough for what came next, which was going to be complicated in ways that ICU nursing had not prepared her for, even though everything before ICU nursing had. She picked up the bedside phone and called the nursing station. "This is Voss. I need a security hold on Bay 1. No visitors, no additional personnel, physician access only until Dr. Gale clears the patient." The day shift coordinator on the other end sounded uncertain. "Is there a clinical reason I can document?" "Patient instability and infection control precaution. I'll have Dr. Fitch countersign." She hung up before the coordinator could ask follow-up questions. She sent another text. "Primary escort is the target. He left the unit. Find him before he comes back." This time, the reply took 40 seconds. When it came, it was longer. "Federal agents en route. ETA, 22 minutes. Keep patient conscious if possible. Do not confront escort directly. 22 minutes. Fitch came back through the door 3 minutes later. Echo is on its way up. Gale's coming from the OR. He was already in there for something else. He'll be another 15, 20 minutes. I've requested a security hold on the room, Dara said. Fitch stopped. On whose authority? Mine, pending your counter-signature. Patient instability and precautionary infection control. Voss. Fitch's voice took on the particular register of a physician who was deciding whether to push back. This patient has federal escorts. I can't just... One of the escorts left the unit 8 minutes ago without notifying staff during a cardiac event. Dara kept her voice level. I don't know where he is. I don't know if he's coming back. Until I do, I don't want anyone I can't identify at this bedside. A pause. Fitch looked at Tate, who was watching the exchange with those still, assessing eyes. Then she looked back at Dara. Countersigned, she said, and went to make another call. The Echo Tech arrived at 9:11 with the portable machine, and for the next 14 minutes the bay was occupied with the focused technical work of imaging the heart and abdominal structures of a man who should not have survived his first hour in this building. Dara stayed in the room, positioned where she could see the bay door and the window into the unit simultaneously, and she did not allow herself to think too far ahead, because thinking too far ahead in a situation that was moving this fast was how you made the wrong call at a critical moment. The results came back better than expected. The internal bleed had mostly tamponaded itself, a fact that the Ecotech described as unusual, and Gale, arriving at 9:27 with surgical gown still untied at the back, described as frankly improbable. The pericardium was intact. The lung was re-expanding around the chest tube. The right heart was showing signs of strain, but nothing acutely catastrophic. Extubation trial, Gale said. He looked at Tate. Can you understand me? One blink. Squeeze my hand. A grip that was weak but purposeful. I'm going to take the tube out. It's going to be uncomfortable. Your job is to breathe when I tell you. He looked at Dara. 30% FiO2. Keep the BVM ready. I want suction at the bedside. She had all of it ready before he finished the sentence. The extubation took 4 minutes. It was not clean. It was never clean. There was gagging and coughing, and the particular wet sound that came with clearing a tube that had been in place for 6+ hours. And Tate's oxygen saturation dropped to 84 before his airway cleared and he found his own breathing, and the BVM came close to being used before it wasn't needed. His first independent breath was ragged and insufficient, and his second was better, and his third was almost adequate, and Dara had the non-rebreather mask on him before the fourth, because 84% on room air was not a number she was comfortable with. The Sautis came up. 88, 91, 94. Gale stepped back. Okay, good. He looked like a man who had been surprised more times in the last 8 hours than he was accustomed to. Let's give him a few minutes to stabilize his mechanics before... Hulk it. Tate's voice was wrong, raw and rough and barely there, abraded by the tube and the damage and the hours. But it was a voice. It was words. It was the first time he had spoken aloud in whatever span of time had passed since before the medevac, and what he chose to spend the effort on was not asking for water or orienting to location. Halkett needs to be detained. Gale looked at Dara. Who is Halkett? His escort, she said. The federal? He's not federal. Tate's hand was on the bedrail, gripping it with the unsteady strength of a man whose body was working significantly below its normal operating parameters. His credentials are cover. He's the officer who sold my team's position. He stopped, coughed, the sound of it catching in his damaged chest, and she put her hand on his back and he accepted the support without acknowledgement, just used it and kept talking. He knew the authentication protocol. He knew I'd been SERE activated. The notation in my chart, he put it there to make sure I stayed sedated. The room was quiet except for the ventilator that was no longer running and the monitors that were. Gale was looking at Tate with the expression of a physician whose professional domain was being rapidly occupied by a category of problem he had no training for. I need to call... Don't call through the hospital system, Dara said. Use your personal cell. Don't go through the switchboard. She looked at him. Please. He looked at her. He was a good surgeon, and she had decided early in her time at Harwick that good surgeons were generally pragmatic about information. They made decisions based on what was in front of them rather than what was supposed to be possible. He took his personal phone out of his coat pocket. Who am I calling? Hospital security first, then whoever your emergency administrator contact is. Tell them you have a potential security breach involving a federal impersonator in a sensitive patient case. Don't use names on the call. She paused. And tell them to check the stairwells. He went into the corridor to make the call. Fitch was still in the room. She looked at Tate, then at Dara, with the expression of a person recalibrating their understanding of a situation in real time. How long have you known? 40 minutes, Dara said. 22 minutes ago, I contacted someone who has the authority to move on it. You contacted who? On a personal cell? Someone with the right clearance and the right oversight authority. She looked at Fitch steadily. I know this is outside the normal process. Outside the normal process. Fitch repeated it like she was checking whether the phrase adequately covered the situation. Voss, I don't even know what your background is. I know. Should I? The answer to that was complicated. It was complicated in a way that involved 7 years of deliberate distance and a decision she had made in a facility she wasn't allowed to name, and it wasn't a conversation she was going to have in a critical care bay with a patient who needed her attention on him rather than on her own history. Not today, she said. Today you just need to know that the calls I've made are the right calls. Fitch held her gaze for a moment, then nodded once, tightly, the way people nodded when they had decided to extend trust they couldn't yet verify. Tate's oxygen sat on the monitor read 96. His heart rate had come down to 94, still elevated, but the elevation of a body working rather than failing. His blood pressure was the best it had been since admission. She looked at him. He was looking at the bay door with the patient, exhausted attention of a man who had decided that the mission wasn't done yet, and that exhaustion was not a valid reason to stop running it. There are agents coming, she said. 20 minutes ago I was told 22 minutes. That means they should be close. Halkett will know the moment federal credentials hit the building entrance, he said. His voice was getting marginally less destroyed with each sentence. He has access to... There were contacts placed inside the base communications network. He'll know. Then he'll run. Or he won't. Tate looked at her. If he thinks I'm still sedated, still not talking, he might not run. He might wait to confirm the situation before he moves. That's how he operates. A pause. He's not impulsive. That's what made him effective. She thought about the 8 minutes since Halkett had left the unit. He hadn't run in the first 8 minutes, which was either confidence or calculation. If Tate was right, if Halkett's model of the situation still had Tate unconscious and non-communicating, then he didn't know yet that everything had changed. The extubation, Dara said. He knows the extubation was being considered? Tate looked at her. Who was on the phone when you were paged back in here? She hadn't told him about the phone call. She hadn't told him Halkett had been on a call when she'd gone to the bathroom. The calculation landed. Halkett had been on the phone during a cardiac event, getting information about the extubation timeline, possibly, getting information about the patient's improving status, getting information that would tell him his window for doing something about the situation was closing. The 8 minutes wasn't confidence. It was preparation. She took out her phone and typed, He knows about the extubation. He's preparing to move, not running. The reply came faster than she expected, faster than she thought the distance could account for, which meant whoever was on the other end was not 22 minutes away. We're in the building. Where's the second escort? She looked at Tate. The younger escort, the one who was with Halkett. Who is he? Tate's expression shifted. His name is Ruiz. He's not part of it. He's legitimate. He's been with me since the medevac. She started to type that information. The bay door opened. Not Gale, not Fitch, not hospital security, not anyone she had been expecting in the next several minutes. Halkett came through the door with his credentials folder open in his left hand and an expression of controlled urgency that was so precisely calibrated it would have read, To anyone who hadn't spent the last hour running threat assessments on the man as exactly what it was pretending to be, an official returning to manage an escalating situation involving a sensitive patient. His right hand was at his side. She couldn't see what was in it from where she was standing. What she could see was that his eyes went immediately to the monitor, registered the ventilator alarm, silence, registered the non-rebreather mask rather than the intubation tube, registered Tate's open eyes and his grip on the bed rail, and the calibrated expression underwent a shift so small and so fast that she almost missed it. But she had been trained to read the micro-expressions of people who had spent careers learning not to have them. And what she read on Halkett's face in that half-second was not urgency. It was the rapid, ice-cold recalculation of a man who had just discovered that the situation he thought he controlled had stopped being controllable approximately 40 minutes ago and was now working out with total precision exactly how many options he had left. He looked at Dara. "Step away from the patient," he said. His right hand came up. The thing in Halkett's right hand was not a weapon. It was a syringe, capped, preloaded, the kind that came from a pharmacy drawer rather than a field kit, which meant he had prepared it here, in the building, sometime in the last 8 minutes, while Dara had been in Bay 1, managing the extubation and believing the most immediate danger was a man who might run. She had been wrong about the running. Tate had been right about the calculation. Halkett had not come back to escape. He had come back to finish the original problem, which was a SEAL who knew too much and a window that was closing. "Step away from the patient," he said again. His voice was the same measured, official tone it had been every time he had spoken in this unit. The credentials folder was still open in his left hand, the way you held a folder when you wanted everyone in a room to keep looking at the folder. "This is a classified medical situation, and I'm authorized to administer—" "No, you're not," Dara said. She did not step away. She had approximately 2 seconds to make a decision, and she made it the way she had always made decisions under pressure, not by thinking through a tree of options, but by identifying the single thing she was not willing to let happen and building backward from there. What she was not willing to let happen was that syringe reaching Tate's IV line. Everything else was negotiable. She shifted left, putting herself between Halkett and the IV pole. And she did it the way she moved around a bed during a procedure. Efficiently, without hesitation, the movement of someone who belonged in the space and was simply doing their job. It was a physical claim on the territory between Halkett and the patient, and she made it before he had time to reframe what she was doing as resistance. "Dr. Gale is in the corridor," she said. "Dr. Fitch is in the unit. Whatever authorization you're claiming, it goes through them first. That's hospital protocol for any medication administration, classified patient or not." Halkett's eyes ran over her face with the same assessment quality she had seen in Tate's, but colder, more practiced. The evaluation of a man who had made these calculations professionally for a long time and was making one now. "You've been interfering with this patient's care since admission," he said. "That's going to be a problem for you." "I've been providing this patient's care since admission. There's a difference." She kept her voice even. "And right now, that care does not include any medication you're holding." "Dara!" Tate's voice, raw and insufficient, but there. "He has a second access point. Left arm." She looked. The left arm, the one she hadn't recited the IV on because the original line was still holding, had a saline lock at the antecubital fossa, capped and unused. Halkett had been in this room before. He had looked at this patient's arms. He knew exactly where to go that wasn't the pole she was currently blocking. She moved left again to cover the second angle and knew immediately it was the wrong call because moving left was moving away from the door, and Halkett used the diagonal she had opened to step closer to the bed's right side. They were doing a geometry problem in a 12 by 14 room, and it was not going the way she needed it to go. Then the door opened behind Halkett, and everything changed. Not Gale, not Fitch. Not hospital security responding to a call that had been made approximately 8 minutes ago and apparently had not yet produced results. It was Ruiz, the younger escort, the one Tate had said was legitimate, and he came through the door at a controlled speed that was not running but was definitely not walking, and he looked at the room in a single sweep and landed on Halkett's right hand with an expression that arrived somewhere between recognition and devastation, like a man who had suspected something for a long time and had just had it confirmed at the worst possible moment. "Sir," Ruiz said. His voice was careful in the way voices got careful when the wrong word could ignite something. "Sir, there are federal agents in the building." Halkett didn't turn around. "I know. They're asking for you specifically, by name." A pause. "By your real name." The syringe didn't lower, but something in Halkett's posture underwent a subtle, significant shift. The microscopic adjustment of a man who had just internally reclassified his situation from manageable to terminal, who was now running the math on what actions remained available in a room that had just had its exit partially blocked by someone who was supposed to be on his side. "Ruiz," Halkett said, "wait outside." "I don't think I can do that." A silence, short and dense with everything that wasn't being said. "You've been with me for 4 months, Halkett said. Not threatening. Almost in another context, reasonable. "You know how these operations work. You know what's at stake when a mission goes sideways, and I know what's in Commander Harlow's medical chart," Ruiz said. "I put the SERE notation in. You told me it was a standing protocol requirement, and I didn't question it because you were my superior officer and I was stupid." His voice had an edge that wasn't anger exactly, but the close relative of anger that came from realizing you'd been used by someone you trusted. "I'm not waiting outside." Halkett turned then, not to face Ruiz, to assess the door, measuring distance, measuring the gap between Ruiz's position and the exit, running the physics of a room with 3 people in it, and one of them holding something he very much did not want to lose. What he did not factor was Tate. Tate had been quiet for the last 90 seconds. Consciously quiet, Dara understood, because conserving energy was the rational decision for a man whose oxygen sat was 96 and climbing, but whose blood pressure was still 68 over 43, whose heart rate was 94 and trending in the wrong direction again. He had been lying in the bed with his hand on the bed rail and his eyes running the same assessment they had been running since the tube came out, and he had been waiting for the moment that the geometry of the room changed in a way that gave him a viable option. Halkett turned to check the door. Tate's right hand, the one he had unbuckled from the restraint an hour ago, came off the bed rail and caught Halkett's right wrist. Not a grip that could hold, not with the muscle mass he had lost and the damage that was still in his shoulder and the blood pressure that could not support sustained exertion. He knew that. The grip wasn't meant to hold. It was meant to redirect, a single controlled motion that leveraged the body mechanics of someone who was already turning, augmenting Halkett's own rotational momentum, and what it produced was Halkett's right hand going into the bed rail with enough force that the syringe bounced free and skittered across the floor toward the monitoring cart. Halkett recovered fast. Faster than a civilian, faster than a desk officer, fast in the way that told Dara something about his background that his credentials had not. He pulled his wrist back and turned toward Tate, with a flash of something in his expression that was not calculation anymore, but the simpler and more dangerous thing underneath the calculation. Dara was already on the floor picking up the syringe. She stood up, put it in her scrub pocket. "Looking for this?" Halkett looked at her, looked at the pocket, looked at Ruiz blocking the door. And the calculation came back online because it was the only thing he had left to work with, and it ran very fast and came up with an answer that was visible on his face. Not in the muscles, which were still controlled, but in the eyes, which had the quality of someone who had done the math and found that all the numbers came out the same. He sat down on the chair at the side of the bay. Not surrender, not exactly. It was more like a man who had identified the most strategically sound position in a room where the tactical situation had resolved against him, and had chosen it deliberately rather than being forced into it. "I want counsel," he said. "You're going to have it," Ruiz said. The federal agents arrived in the unit 40 seconds later. 2 of them, in civilian clothes that didn't quite conceal the particular shape of people who spent significant time in rooms where being prepared for physical confrontation was part of the job description. They had actual credentials. Dara checked them, briefly, because at this point she was checking every credential that entered the room. And they had a third name she recognized from the text exchange. The man she'd called an hour ago, who had said I was wondering when you'd call, who had turned out to be approximately 11 minutes away rather than 22, and had spent the intervening time getting into position without announcing himself. His name was Warren Solt, and he looked exactly the way he had looked 7 years ago, like someone had assembled him from spare parts that individually seemed unremarkable, but together produced a person who was difficult to ignore. He came into Bay 1, looked at the room in the way people with his background looked at rooms, and then looked at Dara with an expression that contained approximately 2 decades worth of complicated professional history compressed into a single glance. "You look tired," he said. "I haven't slept." "Me neither." He looked at Tate. "Commander Harlow, I'm Solt, JSOC, Inspector General's office. We've been working your team's case for 6 weeks. Tate looked at him from the bed with the particular attention of a man receiving information he was deciding whether to trust. 6 weeks, he said. My team went into the ambush 10 days ago. We didn't know the source of the compromise until 4 days ago. And we didn't have authorization to move until we had evidence that would hold. Solt's voice was flat and factual in the way that didn't soften things. I'm sorry about the timeline. I know what it cost. A silence that was not comfortable and was not supposed to be. His team, Dara said. Were they recovered? Solt looked at her, then back at Tate. 3 members were extracted in the 48 hours after the ambush. 2 are in stable condition at a military facility. 1, Petty Officer Garza, did not survive the extraction. Tate's grip on the bed rail tightened. His jaw set. He didn't close his eyes, which Dara suspected was a conscious decision. And the 4th, he said, Petty Officer Reyes. Solt was quiet for a half-second that communicated everything. Still in the field, active recovery operation as of 0600 this morning. Tate said nothing. He looked at the ceiling. He breathed, which was what his body needed him to do, and was also the only thing available to him right now, being in a hospital bed with a chest tube and a blood pressure that wouldn't tolerate standing up. Dara watched his face and said nothing. There was nothing that needed to be said. Halkett was removed from Bay 1 by the 2 federal agents with a quietness that was more unsettling than drama would have been. No cuffs, no announcements, just 2 people on either side of a man who had stopped resisting and was now performing the careful cooperation of someone who was already thinking about what his attorney was going to say. He walked out of the bay at a measured pace and did not look back at Tate. Tate watched him go. The expression on his face was not satisfaction. It was something more exhausted and more complicated than satisfaction. The expression of someone who had been carrying the weight of a name, Black Talon, across an ocean and through an ambush and 3 cardiac arrests and a 6-hour stretch on a ventilator, and had finally put it down, and was discovering that putting it down did not feel the way he had expected it to feel. The next 3 hours were medical. Dara stayed because no one told her to leave, and because the work was not done. Tate's hemodynamic stability was real but fragile, and the chest tube needed monitoring, and the lab values needed tracking, and there were approximately 47 things that required nursing attention from a person who knew his clinical baseline, which was her and nobody else currently on the unit. Fitch reassessed him at 11 and upgraded his status from critical to serious, which was a significant improvement and resulted in Gale appearing briefly in the doorway with the expression of a man who had not expected to be having this particular kind of day when he'd come in for his OR shift. He looked at the monitor, looked at Tate, looked at Dara, and said, "Whatever you did, keep doing it," and left without further elaboration, which was, Dara had come to understand, Gale's version of fulsome praise. Solt set up a temporary working space at the nursing station. Laptop, encrypted phone, a folder that he did not open when anyone from hospital administration was in the immediate vicinity. He was systematic about it, the way she remembered him being systematic about everything. He had aged since she'd last seen him, but not badly. He looked like someone who had been doing difficult work for a long time and had found a way to carry it without being broken by the weight. At 12:30, he came into Bay 1 and stood at the foot of the bed with the folder open. Commander Harlow, I need to walk you through what we have and what we still need from you, if you're up to it. Tate looked like a man who had been awake for an indeterminate number of consecutive hours and had also recently had a ventilator removed from his throat and had also recently tried to physically redirect a man attempting to inject him with an unknown substance. He looked, in short, not up to it. "Walk me through it," he said. Solt went through the case with the efficiency of someone who had structured the information precisely for this conversation. Halkett, his real name was Raymond Tusk, a logistics officer with 14 years of service and 6 years of parallel employment providing operational intelligence to a network of foreign buyers, had been identified through a financial irregularity in his unit's procurement records that an analyst in the IG's office had flagged in August. The flag had led to a signals investigation. The signals investigation had led to Black Talon. Black Talon had led, eventually, and too late to prevent the ambush, to the discovery of the leaked operational coordinates that had sent Tate's team into a prepared kill zone. What Solt still needed from Tate was testimony about the field conditions, specific details of the ambush that could corroborate the signal's intelligence and close the evidentiary gaps that Tusk's legal team would otherwise exploit. And Tate needed to provide that testimony while it was fresh, while his memory of the field conditions was intact, before the physical recovery process and the medication and the time blurred the edges. "Now?" Dara said. Solt looked at her. "The stronger the testimony, the less Tusk can maneuver. He has a SAT of 96 and a pressure of 71/44. He's been extubated for 3 hours. He still has a chest tube." She kept her voice factual rather than argumentative. "How long do you actually need him to hold before the testimony becomes less critical?" 72 hours would compromise the corroboration window. 24 hours wouldn't. Solt considered that. He looked at Tate, who was looking at Dara with the same expression he had been developing in intervals since early morning. The expression that was still running the assessment, but had started finding different answers than it had at 2 a.m. 24 hours, Solt said, and I need his verbal confirmation of 3 specific details today, on record, to support the arrest warrant for Tusk's network contacts. That's 20 minutes. Dara looked at Tate. His call. "Do it," Tate said. 20 minutes. She stepped out of the bay to give them the space. She went to the nursing station and sat down and charted for the first time in 4 hours, working through the documentation backlog with the mechanical focus of a person who needed to do something with her hands while her mind caught up with the morning. Belinda Marsh appeared at 1:15. She had been noticeably absent from the unit for most of the chaos, which Dara understood. Belinda was a charge nurse whose jurisdiction was documentation and staffing, and the events of the morning had been significantly outside that jurisdiction in ways that probably required her to spend time in her office deciding how to relate to them. She came to the nursing station with a different clipboard than usual and an expression that was doing something complicated. "The situation with the federal case," Belinda said. "Administration has been asking about the clinical decisions made on Bay 1 overnight." Dara looked up. "Which decisions?" "The reassessment of the restraints, the extubation request, the security hold you called without going through charge nurse." The restraint reassessment was clinically indicated and countersigned by Dr. Gale. The extubation was Dr. Fitch's call with Dr. Gale concurring. The security hold was countersigned by Dr. Fitch within 10 minutes. She held Belinda's gaze. "If administration has concerns about any of those decisions, they can speak to the attending physicians." Belinda looked at the clipboard. "There's also a question about the nature of your background, whether the hospital has complete information about your previous employment history. That's a conversation for HR. It may become a conversation for administration and legal. Then administration and legal can have it." Dara turned back to the chart. "Is there a patient care issue you need me to address, Belinda? Because I have 4 patients and I'm behind on documentation." A silence. It was a different silence than the ones Belinda usually produced. Less authority in it, something that in another person Dara might have read as uncertainty. "The man from the federal office," Belinda said. "Solt. He asked specifically that you remain on Bay 1 for the duration of the patient's stay." Dara stopped writing. "He spoke to the chief nursing officer," Belinda continued. Her voice had taken on a quality that was new, not warm exactly, but stripped of some of its usual architecture. "There's going to be a formal review of last night for documentation purposes. But the preliminary communication from the CNO is that your clinical decisions were appropriate to the situation. Another pause. I may have suggested a reassignment at an inopportune time last night. Dara looked at her. You were following protocol. I was following my assessment of a situation I didn't fully understand. It was as close to an acknowledgement of error as Belinda Marsh was probably constitutionally capable of producing, and Dara recognized it as such. We're good, she said, and meant it, mostly. People operated within what they knew. Belinda had not known enough, and she had made the calls available to someone who didn't know enough, and the outcome had been suboptimal but not catastrophic. And that was most of what you could ask for in a unit that ran on incomplete information at 3 a.m. Belinda nodded and moved on without further elaboration. Solt came out of Bay 1 at 1:47. He looked slightly less compressed than he had going in, which Dara interpreted as the testimony having gone adequately. He came to the nursing station and sat across from her with the folder closed on the desk between them. I owe you an explanation, he said. You owe me an update on Reyes. He looked at her for a moment. Still in progress. Last contact was 3 hours ago. The extraction team is in position. She nodded, filed that. What did you mean when you said you were wondering when I'd call? There's been a flag on your name connected to this case since we identified the SERE activation in the field report. I knew if Harlow made contact with anyone who understood the protocol, it would be someone from the old program, and the list of people from that program with current medical access to a military treatment facility is short. How short? You were the only one. He leaned back slightly. I didn't know it would be you specifically until the transfer orders came through for Harwick, and I cross-referenced the nursing staff roster. She thought about what that meant. The degree to which the convergence she had experienced as coincidence had been, if not predicted, at least anticipated by someone who had been running the same kind of analysis she used to run. You could have called me. You left the program. Voluntarily. I wasn't going to pull you back in without your consent. But you were ready for when I called. I'm always ready, he said, which was, she knew, not arrogance, but a simple description of how Solt operated. He had been ready for her call in the same way he was ready for every contingency, not because he knew exactly what would happen, but because he had thought through enough of the space that when something happened, he had already been there. At 2:15, Tate's oxygen saturation dropped 2 points. She was back in Bay 1 in 90 seconds, checking the chest tube for complications. There were none. It was positional. She adjusted the angle of the bed, and the SAT came back up, and she stood at the bedside rechecking his breath sounds with the stethoscope and listening to the quality of his lung expansion. Better on the right, she said. Left still has some crackles in the base. I know, he said. His voice was better than it had been this morning. Not good, but better. You're going to need respiratory therapy twice a day minimum, and I need you to stop tensing your chest wall when I do the percussion. I can hear you bracing. It hurts. I know it hurts. Brace less anyway. She moved the stethoscope. Deep breath. He took one. You've done this before, he said. Not the nursing. Something else. Worked a case where I was the only person in the room who understood what was happening. She listened to the left lower lobe. Once, a long time ago. What happened? The patient made it. She pulled the stethoscope out of her ears. It was different enough from this that the comparison isn't very useful. But the outcome was the same. She looked at him. He was watching her face with the assessment quality still present but transformed, less threat calculation, more something she didn't have a clean professional category for. Curiosity, maybe. The specific curiosity of a person who had been pulled back from a significant edge by a stranger and was now in the position of renegotiating what a stranger meant. The outcome was the same, she said. He looked at the ceiling for a moment. Garza had a kid, 8 months old. He showed me a picture the night before we went in. His jaw was tight in a way that had nothing to do with pain management. The picture was on his phone. I don't know if anyone will think to... If the family... Tell Solt, she said. That's something Solt can make sure gets handled right. He nodded, once. The tightness didn't leave his jaw. She was checking the chest tube insertion site when his monitor alarmed. Not a rate alarm, not a pressure alarm, a different alarm, the one connected to the telemetry notification that was linked to Solt's temporary workstation at the nursing station. She looked up at the screen, and the readout that had appeared was not a medical value. Someone had linked the telemetry unit to a text notification system, which should not have been possible from the nursing station, and the text that had appeared on the secondary screen was 4 words in an operational shorthand she recognized from years ago. Reyes out. All clear. She read it twice. Looked at Tate. He had read it too. His eyes were on the screen and his chest was moving with a breath that was slightly different from the breaths before it, the kind of breath that happened when something a person had been holding finally found a place to go. His SAT dropped 1 point, then came back. She turned off the telemetry notification. It wasn't supposed to be there. It was going to cause problems with the monitoring system if it stayed connected, and made a note in the chart that the alarm had been a false positive from a linked system. She did not note what the linked system had said. At 3:45, Solt knocked on the bay door and came in with an expression that was doing something she hadn't seen on it before. Not satisfaction exactly, but the close relative of it that serious people allowed themselves when serious work came through. Tusk's network, he said. 4 additional arrests in the last 2 hours. Domestic contacts. The intelligence package is complete. He looked at Tate. It's done. Tate looked at him. All of it? All of it that's actionable. There will be a full court-martial proceeding. It will be long, and it will be ugly, and you will have to testify when you're well enough to do it. But the operational piece is done. A pause. Reyes is at Landstuhl. She's stable. Something in Tate's face rearranged itself in a way that was not reducible to a single emotion. He pressed his lips together for a moment, looked at the ceiling, breathed. Solt looked at Dara. There's going to be a formal debrief of your involvement. For the record, it's not optional. I know. It's going to involve questions about your background that the hospital administration will also be asking. I know that too. Your licensing and your current position they're not in jeopardy. What you did was within your scope and then some, and the outcome speaks for itself. But there are going to be people with forms who need you to explain things. He paused. I'll be there when they ask. She looked at him. I know you don't need it. I'm offering it anyway. His voice was the same flat factual register it had always been, but there was something underneath it that was not flat. You walked back into something you spent 7 years walking away from, and you did it at 2 a.m. with no backup and no authorization, and it worked. The least I can do is sit in a room with you while bureaucrats ask you about it. She didn't answer right away. Outside the bay, she could hear the unit running. Monitors and voices, and the particular rhythm of a place that kept moving regardless of what had happened inside any individual room. Belinda Marsh was probably back at the nursing station. Gord Saviour's shift was ending. Priya was charting in Bay 3. Fine, she said, but I picked the day. Solt almost smiled. It didn't quite complete the journey to an actual smile, but it came closer than she remembered him getting in the old days. He turned and left the bay. She turned back to Tate. He was watching her with the expression that she had been watching develop across the last 14 hours. The threat assessment long gone, replaced by something that was still attentive and still careful, and still the expression of a man who did not give trust easily or quickly, but was sitting now in a particular configuration that was different from the one he had come in with. You're going to need to let me do the respiratory therapy, she said. I'm not arguing. You were bracing. I'll work on it. She pulled the stethoscope back out. He watched her with that expression, and she let him watch, because he had earned the right to look at whatever he needed to look at after the night they had been through. She was lifting the stethoscope when his hand caught her wrist. Not hard, barely a touch. She looked at it, then at him. You knew the authentication code, he said. 11 words. That code has never been written down. It was conveyed verbally in a classified briefing to a list of personnel that I was told numbered fewer than 40 people globally. His grip didn't increase, but it didn't release either. I need to know which briefing you were in. She looked at him. She had been waiting for this question. She had known it was coming since the moment she had spoken those 11 words into his ear, because speaking them had told him something about her that she hadn't told anyone in 7 years, and a man like Tate Harlow did not let a thing like that go unexamined. "Bragg," she said. "November, 12 years ago. I was there as a behavioral analyst, not an operator. There were 31 people in the room." He looked at her for a long moment. The hand on her wrist didn't move. "I was in that room," he said. She had not known that. She had known the briefing list was operational personnel plus support staff, and she had not known the names because the names had been classified separately. And she looked at his face now. The old scar along the left temple, the bone structure beneath the damage, and the stubble and the exhaustion. And she tried to place him against a 12-year-old memory of a room full of people she had not been supposed to look at directly. She couldn't. The memory was too old and too carefully not preserved. "I was 24, he said. "It was my first classified operational briefing. I sat in the third row." "I was in the back," she said. He let go of her wrist. Something passed between them in the silence that followed. Not dramatic, not the kind of thing that announced itself, just the quiet and slightly disorienting recognition that the convergence in Bay 1 at 2 a.m. had not been the first time they had occupied the same room, that there was a thread running backward through time that neither of them had known was there until right now. She put the stethoscope on. "Deep breath," she said. He took one. His oxygen saturation read 97, the best it had been since admission. The left lower lobe still had crackles in the base, and his blood pressure was still not where she needed it to be, and there were days of work ahead of him and weeks of recovery after that, and a court-martial process beyond that which would take whatever it took. But he was breathing, and the room outside the bay was running, and Tusk was in federal custody, and Reyes was at Landstuhl, and somewhere in the hospital's administrative offices, a formal review was being initiated that was going to require Dara to explain things she had spent 7 years not explaining to anyone. She was pulling the stethoscope away when his hand moved again. Not the SERE signal, not the letter spelling, not any of the codes she had spent the morning reading. Just his hand, open against the bed rail. And under it, barely visible, a single folded piece of paper that had not been there before, paper from the notepad on the bedside table, written in the cramped, slightly unsteady handwriting of a man who had been working with impaired fine motor control. 3 lines that she read and then folded again without showing her face. The first line was a name she did not recognize. The second line was a rank and a unit designation. The third line was a question. The name on the first line was not Tusk. It was not anyone who had been mentioned today. It was someone who, if the rank and unit designation on the second line were accurate, operated at a level so far above Tusk that the question on the third line was not whether this person existed. The question was whether Dara was willing to find out what they had done. She read the note a second time in the staff bathroom, with the door locked and the water running, which was becoming a habit she was going to have to break once this was over. The name on the first line was Brigadier General Lowell Mast. The rank and unit on the second line placed him as the senior logistics coordination officer for the entire theater command that had overseen Tate's operational area. Not a peripheral figure, not someone who could claim ignorance of the missions running under his authority. The question on the third line was 6 words. How deep does the network go? She stood there with the paper and thought about what Tate had done. He had spent everything he had this morning on Tusk, getting the name out, getting it to her, enduring the extubation and the confrontation and the 20 minutes of testimony with Solt. And then, when all of that was done and the room had settled and she had thought the acute phase was over, he had written 3 lines on a notepad with a hand that could barely hold a pen and put it where only she would find it. Not Solt. Her. She thought about why. She thought about the chain of trust that had been established in this room across 14 hours, the specific and non-transferable quality of what they had built in the space between a bed rail and a non-rebreather mask, and 11 words spoken in the dark. He trusted Solt to do the institutional work. He trusted her with the thing that the institutional work might not reach, because she had come at this from outside the system and had reached in and pulled him back, and that meant she could go places that someone inside the system might not be able to go without being seen. She folded the note and tucked it into the inner pocket of her scrub jacket where it sat against her sternum for the rest of the afternoon. She went back to Bay 1. She did the respiratory therapy. She charted. She pushed fluids and watched the blood pressure numbers edge upward in the slow, non-linear way of a body that had been comprehensively damaged and was doing its own accounting on the pace of repair. Tate slept for 2 hours in the late afternoon. Genuine sleep, not the artificial depth of a SERE-activated shutdown, but the sleep of someone whose nervous system had finally accepted that the threat was gone and that sleep was now the most useful thing it could do. She watched him sleep, and she thought about Mast, and she thought about the question on the note, and she thought about what it meant that the question existed at all. At 6:15, she called Solt from the corridor outside the unit. "I need 20 minutes when you have them," she said. "I have them now." "Not here." She looked at the unit entrance. "Somewhere that's not this building." A pause. "There's a diner on Harwick Road 2 blocks south, the kind with bad coffee and good parking." 45 minutes. She handed off her patients at shift change. There was a night shift nurse named Donal who was competent and thorough and who she briefed on Tate's status with the specificity of someone who intended to sleep tonight but needed to know that what she was leaving behind was in adequate hands. Donal had 12 years of ICU experience and the unflappable quality of a person who had seen enough genuinely alarming things that the merely dramatic had stopped registering as a problem. "Anything unusual I should know about?" Donal said. "Everything about this case is unusual," she said. "But clinically, respiratory therapy at 2200, chest tube output every 2 hours. BP goal is mean arterial pressure above 65. If his rate goes above 110, call me first, then Fitch." "You're not on call." "I know. Call me anyway." She changed out of her scrubs in the locker room and drove 2 blocks south on Harwick Road and found the diner, which was exactly what Solt had described. Vinyl booze, fluorescent lights, coffee that arrived in the kind of thick ceramic mug that communicated a fundamental indifference to presentation. Solt was already there. He had ordered 2 coffees and a piece of pie that he wasn't eating. She sat down and put the folded note on the table between them. He looked at it, looked at her, picked it up and read it, and she watched his face do the same thing Tate's had done in the bathroom mirror in her imagination. The rapid recalculation, the grim arithmetic of a situation that had just expanded past the boundaries she had thought it had. "He told you this," Solt said. "He wrote it." "When?" "This afternoon, after your debrief." Solt set the note down carefully, like it was something that had achieved additional weight in the act of being read. He picked up his coffee and didn't drink it. "Mast is not a name we have in the current investigation." "I know. If Harlow is right about his role, then what we arrested today is one operational layer below the source. Tusk was the mechanism. Mast, if this is accurate, is the person who built the mechanism." "I know that too," she said. "Is it something your office can move on?" "Not without evidence. Tusk will have his legal team building a defense for the next 6 months, and they're not going to produce anything on Mast voluntarily." He looked at the note again. "The question is whether Harlow has something specific, testimony, documentation, something he saw or heard that points upward, or whether this is a direction rather than a lead. I don't know. He wasn't well enough for me to ask him more than he gave me." She wrapped her hands around the coffee mug. "The warmth was useful. But he gave me the name instead of giving it to you. I think that means he has something that he believes requires a different kind of handling." Solt was quiet for a moment. The diner ran around them. A couple in a corner booth, a man reading a newspaper at the counter, a server who was attending to something in the kitchen. Normal evening, unremarkable. "You're not in the program anymore," Solt said. "I'm aware. If you get involved in an active investigation at this level, it's not a consultation. It becomes something with a structure and a clearance and obligations." "I understand what it becomes." He looked at her. The gray eyes were doing the same thing they did across every interaction she remembered with him, measuring, not unkindly, the distance between what she was saying and what she was prepared for. He had always been good at that. She had always found it slightly annoying and also fundamentally useful, which was the same complicated relationship she had had with most things about the old work. "You left voluntarily," he said. "That was the right call at the time. I never questioned it." "I know you didn't." What I need to know is whether today changed something for you or whether you're making a decision based on adrenaline and the specific intensity of a 14-hour crisis situation. He said it without judgment, which was what made it land. Because both of those things are real, and one of them is a better basis for a commitment than the other. She thought about it honestly. She thought about Tate's hand on the bed rail and the SERE signal she had not expected to ever see again, and the specific quality of arriving at a bedside where she was the only person in the room who understood what was happening. She thought about what that had felt like. Not triumphant, nothing as clean as that, but necessary in a way that bypassed the question of whether she wanted it to be. I was always going to be the person who walked back in when it mattered enough, she said. I just didn't know what enough was going to look like. Solt nodded slowly. He picked up his fork and cut a piece of the pie he hadn't been eating and ate it with the focus of a man buying himself a moment to think. Then he put the fork down. Then here's what happens next, he said. What happened next was not fast or cinematic. It did not resolve in a single dramatic reveal. It took 11 weeks, a formal reinstatement of her operational consultant clearance, 4 separate testimony sessions in a federal facility, she had to sign a form to enter, and a level of documentation that made her hospital charting look like a casual suggestion. But it happened. Warren Solt's office built the case against Lowell Mast in the same systematic way it had built the case against Tusk. Carefully, with the specific patience of people who knew that a rushed case against a brigadier general would be torn apart by counsel, who had spent careers preparing for exactly this kind of fight. Tate's testimony was the cornerstone. He had, as Solt had suspected, specific evidence, a conversation he had intercepted in the field, a fragment of communications intelligence that had not made it into the official report because Tate had not fully understood its significance until the ambush made the significance retroactively clear. In the context of everything else, that fragment was the connective tissue that held the case together. Dara provided a different kind of testimony. She was asked to document the sequence of events in Bay 1, the behavioral indicators she had observed, the clinical decisions she had made, the communications with Solt, and the timeline of Halkett's identification. She was asked to explain, in detail that was then classified, the nature of her previous operational training and the specific knowledge that had allowed her to recognize and respond to Tate's signals. She did it with the same clarity she brought to everything, factual, sequential, careful about the distinction between what she knew and what she inferred. The debrief panel asked her at one point whether she had hesitated before getting involved. The question was procedural, but she sat with it for a moment before answering. I hesitated for about 3 seconds, she said. Then I read the signal again, and I stopped hesitating. They wrote it down. Raymond Tusk was formally charged on 7 counts, including conspiracy to commit espionage, unauthorized disclosure of classified information, and obstruction in a federal investigation. His court-martial began 43 days after his arrest. He entered a plea of not guilty that his legal team walked back in the 3rd week of proceedings when the signal's intelligence was entered into evidence. He was convicted on 6 of 7 counts and sentenced to 22 years. He would be 59 by the time he finished serving it, assuming no early release, which his sentencing judge had gone out of her way to indicate she did not anticipate recommending. Lowell Mast's case moved on a longer timeline. He was quietly placed on administrative leave in the 3rd week of November, which generated a brief, uninformative official statement about an ongoing internal review. He was formally charged in January of the following year, 9 months after the night Dara had first heard a dying man's fingers tapping on a bed rail. His charges were more extensive than Tusk's. He had been the architect of the network for 6 years, and the case against him included testimony from 3 additional witnesses that Solt's office had developed in the months between Tusk's arrest and Mast's. He did not take a plea. His trial lasted 11 weeks and produced a verdict that was read into the public record on a Tuesday afternoon while Dara was in Bay 2 at Harwick, changing a chest tube dressing, and did not hear about until Donald texted her a news alert at the end of her shift. Guilty on all counts. Sentenced to 31 years. She read the alert in the corridor outside the locker room and stood there for a moment with her phone in her hand and the particular quality of an ending settling into the air around her. Petty Officer First Class Inez Reyes returned to the United States in December. She had lost 2 fingers on her left hand in the ambush and had spent 6 weeks at Landstuhl before being transferred to a rehabilitation facility in San Antonio. She was not deployable in her previous capacity. She was also, by all accounts, deeply and comprehensively alive, which was the more important of those two facts. She sent a message through Solt's office to Dara, brief, not the kind of message that tried to do too much, that said simply, "I heard what you did. Thank you for giving me enough time to get out." Dara sat in the staff bathroom and read that message 3 times before putting her phone away and going back to work, because that was what the shift required, and because the alternative was sitting in a bathroom crying, which she was not going to do at work, even though the impulse was there and was not something she was ashamed of, just not something she had time for in the middle of a Tuesday evening ICU. She did cry in her car, afterward. She sat in the parking garage and cried for approximately 4 minutes with complete sincerity and no dignity whatsoever, which seemed right. Then she drove home. The formal recognition came in February. Solt's office put through a commendation that was classified in its specific content, but whose existence was communicated to Harwick's administration through official channels. A letter that named Dara Voss, ICU registered nurse, and described her actions in terms that were sufficiently general to be unclassified but sufficiently specific to be unambiguous. The chief nursing officer called her into an office and showed her the letter and said, with the particular tone of someone revising an opinion they should not have needed to revise, that the hospital was proud to have her on staff. Belinda Marsh did not call her into an office. What Belinda did was stop commenting on Dara's documentation speed and stop mentioning her hair and start, very occasionally, in the particular way of someone who had decided to make a change without announcing it, asking Dara's clinical opinion on things. It was not an apology. It was something more practical than an apology, which was the adjustment of behavior by a person who had received new information and had the functional integrity to act on it. Dara found she could respect that. Tate Harlow was discharged from Harwick Military Medical Center 19 days after admission. He walked out under his own power, which Gale had described at the discharge meeting as medically improbable, personally impressive, and clinically inadvisable, and which Tate had acknowledged with the specific expression of a man who was not going to argue about it. He had a follow-up appointment in 6 weeks. He had a physical therapy protocol that Dara had spent 45 minutes reviewing with him because she did not trust that he would follow it without detailed explanation of why each element existed. If you skip the shoulder rotation exercises, she told him, you will lose range of motion that you will not get back. That is not a warning. That is physiology. I understand physiology, he said. You have a documented history of deprioritizing your body's requirements when you have other things to focus on. The SERE activation alone. I understand, he said. And then, after a pause, I'll do the exercises. She looked at him. He was sitting on the edge of the bed in civilian clothes for the first time since she had known him. Dark jacket, plain shirt, the scar along his temple visible now that the bruising had faded. He looked like a different person than the man who had been wheeled through the ICU doors 19 days ago, and also like the same person in every way that mattered, which she supposed was the most that recovery could ever really do. The paper, she said. The paper. Mast is in custody. Tusk is convicted. She held his gaze. Is there anything else on that paper that I should know about? He looked at her for a long moment. The assessment was still there. It would probably always be there. It was structural rather than situational. It was what he was. But it had a different quality now than it had had at 2 a.m. when he had been running it from behind a ventilator tube and a SERE-activated threat response. No, he said. That was everything. She believed him. Or she believed that it was everything he was prepared to put on paper, which was as close to the same thing as the situation required. He stood up, which he did carefully, and without the kind of difficulty she had watched 19 days ago when standing had required her physically steadying him, and he picked up the bag that Ruiz had brought. Ruiz, who had given the most consequential testimony of his career in the weeks that followed and had been cleared of any involvement in Tusk's network, who had visited twice and sat in the visitor's chair with the specific guilt of a person who had countersigned a chart entry he shouldn't have and was going to carry that for a while. The bag was light. Military people packed light. He looked at her. There were things that could have been said. They both understood that. The compressed intensity of what they had been through together was the kind of thing that produced either permanent bond or careful distance or some complicated third option that didn't have a clean name. And neither of them was the kind of person who resolved that question quickly or publicly or by saying too much. The follow-up appointment, she said. 6 weeks. The shoulder exercises start today, not when you feel ready. Today, he agreed. He walked toward the door, stopped, without turning around. Bragg. November. 3rd row from the front, left side. I was sitting next to a man named Torres who was asleep for most of it. She remembered Torres. She had not remembered Tate. 3rd row, left side, she said. He walked out. She stood in the empty bay and looked at the bed that had been stripped and remade and was now simply a bed again, the way it always was when a patient left. Neutral, clean, waiting for the next person who would arrive in the night with something urgent and fragile that needed hands that knew what they were doing. She thought about what Warren Solt had asked her in the diner. Whether today had changed something, or whether she was making a decision based on the intensity of a crisis. She thought about the answer she had given him, that she had always been the person who would walk back in when it mattered enough. And she thought about whether that answer was true, or whether it was the kind of thing you said when you hadn't slept and your hands were still running on adrenaline. She thought it was true. She had tested it against 11 weeks of unadrenalined, well-slept, ordinary Tuesday at work thinking, and it had held, which did not mean it was uncomplicated. It was not uncomplicated. It was the particular complication of someone who had made a life on one side of a line and had discovered that the line was not as fixed as she had believed, that the skills she had carried out of the old world had not stopped being skills just because she had stopped using them, that the things she thought she had left behind had in fact been waiting. Not in any sinister way, not pulling at her, just present, for the moment when it was needed. She had thought leaving was a complete action. She understood now that it was more like a parenthesis, a long, necessary, genuinely valued parenthesis, inside a larger sentence that was still being written. She went back to the nursing station. She had patience. Bay 3 needed a medication check. Bay 4's family had questions about the discharge timeline. Bay 2's blood pressure was doing something that required assessment and documentation and the specific application of trained clinical judgment. She sat down. She pulled up the charts. She did the work. Outside the ICU windows, Caldwell Bay was moving into an ordinary February evening. Gray sky, cold, the kind of weather that made the lit windows of a hospital look almost warm from the outside, like something worth walking toward rather than away from. Inside the unit, the monitors ran their steady rhythms. Somewhere on the floor below, a door opened and closed. Somewhere above, a helicopter that had nothing to do with tonight's events crossed the roof and kept going. Dara Voss had been a nurse for 9 years. She had spent 6 years before that in a world most people would not believe existed over a Tuesday dinner. She had spent 14 hours in the middle of a night saving a man who the room had already given up on, not because she had been assigned to it, not because it was her job in any formal sense, but because she had been the only person present who understood what was happening, and she had decided, in 3 seconds, she had told the debrief panel, that understanding something and doing nothing with it was not an option she was willing to live with. That was the whole of it. That was the story in its undiplomatic, uncinematic core. A woman who knew something, at a moment when knowing mattered, and chose not to pretend she didn't. She was not recognized for it the way the letter said she was. Or rather, the letter was real. And Solt showing up in that room was real. And Gail saying whatever you did, keep doing it was real. And Reyes's message was real. And all of those were forms of recognition that she was not dismissing, but the recognition that meant something was narrower and less expressible than any of that. It was Tate Harlow's fingers going still on a bed rail because she had spoken the right words. It was 96% on the SAT monitor at the end of a shift. It was knowing the difference between a man who was dying and a man whose mind had decided it was safer to let the body die than to risk trusting the wrong person, and knowing, because she had the specific, hard-won, unremarkable knowledge that she had accumulated over years in 2 different worlds, exactly how to reach him anyway. She had been underestimated her whole career in both worlds. The intelligence analyst who thought a behavioral specialist didn't need to be in tactical briefings. The physicians who assumed nurses were executing orders rather than forming independent clinical assessments. The charge nurses who believed that quiet meant uninformed. The administrators who read a clean resume and didn't look further because looking further took effort and the paperwork was already done. She had never corrected any of them in advance. She had learned early that correction in advance was a waste of energy that was better spent on the work, and that the work, eventually, said everything that needed saying. On a Thursday morning in October, it had said it in a hospital room in Caldwell Bay, Virginia, at 6 minutes past 2 in the morning, while every physician in the building had already written the ending, and the nurse leaning over a dying soldier's bed was the only one who knew the ending hadn't been written yet. She picked up her pen. She wrote the medication note for Bay 3. She moved on.